Okay, start.
You ready? Wave to the camera, Connie. Hi, everybody. This is Dr. Kramer at Kramer Chiropractic Livonia Spine and Injury. Today, I have my great friend, awesome patient, Connie. What we're here today is to demonstrate a few exercises for people with chronic low back pain, particularly if you've got hip problems, which is really common. It's really common that people have a hip replacement and they have back pain. So today's top tip is how to fix your low back if you can't do some of the exercises that everyone else does. So the reality is that just like I have injuries in my body, I can't do everything. So we're going to show you some alternative exercises to help make your spine more functional, less pain, better mobility. All right. So the first thing we're going to do is we're going to show something called a banded deadlift. This is we're training a pattern of what we call the hip hinge. So the hip hinge from the side. Okay. So Trina, I want you to get my friend this dead skeleton. So see what happens when you miss your appointments? Not good. So this is your hip. So when we bend, we want to stick our hip back. So we're going to practice something called the hip hinge. Okay? We want to get that motion spot on, because that's how you protect your spine. That's how you relieve back pain, and that's how you lift things without injuring yourself. So this is the hip, okay? And the key is the hip hinge is the hips go back relative to the ankles. So we're going to have a band in front of us, and we're going to look like this. So we're going to do just a small range of motion, maybe our hands just below the knee, and come back. So hips back, and our chest is going to be higher than our hips. Our hips is going to be higher than our knees. And so this is a great exercise for the low back, particularly for people that have some knee challenges. All right? So, Connie, we're going to have you start. I'm going to have you face me. And what we're going to do is we're going to use a band. Most of you have a band at home. You probably put your feet about shoulder width apart. And I'll have you just go ahead and step on the band. All right. Now, what we're going to do is we're going to get in good position and slowly bend forward, hip hinge. Okay, push your hips back and chest out, and just kind of grab the band. Maybe a little bit lower to get some resistance. Right about there. Does that feel comfortable for you?
Yep.
So here's the key. Chest out, big chest. Stand up tall and stand up all the way. Lock your knees. Pull the shoulders back. Not necessarily up, but back. Squeeze your glutes. That feel okay to you?
Yep.
Now, what you're going to do is push the hips back, chest out, and bend forward, chest out. Push the hips back, push the hips back. The hands are going to be right there. Stop right there. Pretty neutral spine. Shoulders are higher. Go ahead, stand up. And now hips go forward. Hips forward, lock your knees, squeeze your glutes hard, pull the shoulders back, squeeze. Crush grip this, really crush grip, arms straight, okay? Do you want to keep the tension the same? Let the shoulders down a little bit. Do you want to keep the tension the same, or do you want to get a little bit more tension?
More tension.
A little bit more tension? All right, so if we want more tension, bend forward a little bit, and you're going to grip a little bit lower, so you get more tension on the band. Just go ahead and grip that. You can grip it any way you want. Chest out, head up. Chest out, and stand up tall. Stand up. Hips come forward, Con. Pull the shoulders back. Good. Squeeze the glutes. Stand tall. Squeeze your glutes hard. Any pain anywhere?
No.
No. If you squeeze your glutes hard, that really prevents you from just hinging in the low back. All right, now push your hips back. Chest out. Go far as you can forward with a little bit of a knee bend. That looks like perfect. If you can go forward more, go a little bit more. That feel good to you?
Yeah.
Okay, stand up tall. Thrust your hips forward. Hips forward. Lock your knees. Lock this knee. Lock it. Stand up tall. Hold. Any pain?
Nope.
Good. So the key is squeezing the glutes. Great job. You can go ahead and put it down. So I'm going to recommend, Con, after you do the warm-ups that I've shown you, we've shown Connie some abdominal strengthening exercises. We've gone over this in the past, but for you new readers out there, new subscribers to my Facebook page, very simple. We've shown the curl up, knees bent, squeeze the stomach. Flatten your back, come up about an inch or two. So we flatten our back, come up an inch or two, squeeze. Then we're going to work the glutes, tighten your stomach, lift your hips. Now, we've talked about this in the past. I've got an added version for you, Con. I'm going to have you ready for summertime, ready for the bathing suit season. So what we're going to throw in, and this is an added glute buster. Now, when you work the glutes, that spares your spine. The stronger, the better functioning your glutes, which is your butt muscle, that's what propels us as a human. That takes stress off your knees. Knee problems and back problems are usually always secondary to hip problems. So what we do to really make this a burner, we use a band. Squeeze, then lift. Hold 5 seconds. Knees out, lift. Squeeze. You should have zero back pain. If you have back pain when you do that, Connie, focusing on tighten your stomach and tighten your glutes. That's your belt. Be your own belt. In other words, you see a weightlifter's belt many times. You don't need that for this. You become your own belt by tightening your stomach, tightening the glutes. Maybe don't elevate quite as high. Now, before we do the stomach strengthening and the glute strengthening, we should always stretch the front of our hips or our hip flexors. Connie, because he has some challenges with the knees, and any of you guys out there that has knee problems, you want to do a modified lunge. And so you use a chair, but here's the key though. You must have hand support in front of your body. There's no good having hand support behind you because I'm going to fall. All right, listen, you don't need another problem if you trip and fall. So we're trying to fix you, not ruin you. So make sure your hand support is in front of your body, tight stomach, okay, and you're going to lunge forward. And you probably might want to spend a minute or two. So spend some time, maybe more, 2, 4, 5 minutes. Put this in front of a TV. Have a glass of wine. Chill out. But you need to have some time to stretch those deep ligaments. It's time dependent, all right? So 10, 20 seconds is probably not enough for you. So you want to build up the time. So as you talk, chill out at the end of the day. Maybe get a chair at your office, but you need to have safety support in front of your body. So we always stretch before we do the hip thrust or strengthen, okay? So we've done our stomach muscles. We stretched our hip. We've strengthened the glutes. Now we do like what we just did. That's called a banded deadlift. But then there's another thing, another exercise we can do to work on some more of the core stabilizing of the spine. And what we call is a suitcase deadlift. It's like you're carrying a suitcase. Now you might have seen people do a plank where they're on their side and they're doing this type of exercise. That's great too. The problem is sometimes it hurts their knees or hurts their shoulders, so we need alternatives, and that's why we're doing this video. And you folks out there can thank Connie because I just thought of him. So what we're going to do is we're going to show a one-arm deadlift. Okay, it's like a suitcase carry. You can walk around your house. I want you to look at me for a second, but I don't want you like this, and I don't want you like this. I want your shoulders level, tight, and I want a good, strong grip. When you grip things strong, you're activating. You're telling your brain to, hey, let's wake up the muscles along the spine. You're activating your whole body, so it's strong grip. And so what we're going to do is the same type of deadlift pattern. Hips back, way back, come back, okay? So my chest is out, I'm looking up, big chest, my hips are back, then I come forward, okay? So Con, I'm going to have you try to do this one. Face me. All right, so your arms straight. We'll just get this out of the way, chest out. Good, and just go ahead and, just like we did before, just go ahead and do the one-arm deadlift. Chest out, big chest, push your hips back. Good, perfect. Stand up tall, squeeze the glutes. Excellent. Let's do 5 reps. Go down very slow, 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 slow. Push those hips back. Really feel a stretch in the hamstring and come up a little faster. Squeeze those glutes. That feels good to you? Should feel like good motion, should feel good. All right, go ahead, do another couple, super slow. Push the hips back. Get a good stretch in the hamstring. Really push that butt. Good. And now stand up. Good. Squeeze those glutes. And as long as your spine is straight and not bending, you're safe. Keep going. Chest out, bend the knees a little bit. That looks excellent. Stand up tall, stand up powerful. Good. Okay, try the other arm. That way we can't have them walking crooked. That way I don't want to give my secrets away. All right, shoulders tight. This is a one-arm, go ahead, a one-arm deadlift. Good, stand tall. Good, squeeze your glutes, pull your shoulders back. Now on this side, you guys can't see it out there in Facebook where he's a little bit off. That tells me there's been a chronic weakness in one of those spinal muscles, which is common. Okay, go ahead. So just kind of look in front of a mirror when you do this. Push your hips back. Good. Chest out, big chest. Good. Stand up tall and powerful. Stand up, lock the knees, squeeze your glutes. Good. And I want you to bend it a little bit to the right when you do this, because we want to activate those muscles. So I want you to look in the mirror. Okay, go ahead. Do another couple. We're almost done. Excellent. Stand tall. Shoulders look pretty level. So just walking around with something in that arm will be helpful for you. Okay? Now, here's the final test. What we did, you came in today, you were in a lot of pain. How you moving now? Since we've adjusted you, did traction, did exercise, how we do it? Now, here's the trick, though. I mean, sometimes we overdo it, right? And so let's test ourselves. Go ahead and lean back. Let's check your mobility. Far as you can go. Good. Stand straight. How you doing with that?
Okay.
No problem?
Fine.
Okay, bend to the right, far as you can. Okay?
I was having real problems.
Any pain with that?
No.
When you first came in, could you do that?
No.
So here's the thing. If it's the right exercise, 9 times out of 10, after you're done, you'll have better movement with less pain. That's how you know. But to be honest with you, if you test yourself, remember, I've always said, test, treat, retest. If you test yourself with a motion, this is a test, this is a test, and your motion is worse, either you did it wrong or maybe you did too much. You see what I'm saying? You guys have the best doctor inside of you. You are the doctor inside you. My job is to help your body heal itself. So I want to help you be a better doctor for yourself. So if you can move better after a test, then you did the right thing. If you can move worse, then you did something wrong. Pay attention what you did, or you did too much, or it wasn't the right time. So again, I want to thank everybody out there. This is a little bit longer video. If you're sick and tired of being sick and tired, you want to see if we can help you, give us a shout at 248-615-1533. I would love to be the solution to your health problems, but guess what? I'm not the solution for everybody. That's the whole purpose of me talking to you, evaluating, and letting you know. If I can help you, I'll tell you. But if I can't be your solution, then I'm going to find someone else to be your solution. Drive safe. I'll see you guys on the next video. Con, wave to your beautiful wife out there. Have a great day. I'll see you guys. Thank you. Thank you.